by professionals, advocates, and visionaries who share interests and commitment to transforming healthcare through innovative approaches. As many of you know, my son faced a courageous battle with neuroblastoma. One of the most cherished, it's not a minute out, I think I'll just talk. All right. So one of our most cherished memories is captured in our cover photo. And as you see here today, Ben in front of Lincoln Center, surrounded by the beauty of music and art. That moment symbolized his love for the healing power of the arts. While music did not change the outcome, it profoundly changed our story, allowing us to create joy and connection even in difficult times. Through our work, we aim to honor Ben's legacy by uplifting, inspiring, and healing through the arts. Our mission is to inspire and empower children, caregivers, and communities through education, integrated programming, and advocacy of healing arts. As a natural extension of our mission, we are now focusing on the education and advocacy for social prescribing. I had the privilege of attending the first U.S. convening on social prescribing at Columbia University with Larissa last year. There I learned that social prescribing is a transformative approach that addresses not only symptoms of illness, but also the broader social determinants of health impacting our communities. By connecting individuals to local resources and support systems, we can enhance well-being, build resilience, and improve overall health outcomes. Today we will explore successful models, share valuable experiences, and tackle the challenges of implementing social prescribing effectively. Our goal is to foster collaboration and inspire practical solutions that can be adapted in our community. Let us engage openly, share our insights, and work together towards a healthier future for all. Now I am pleased to introduce Dr. Sheetal Ajmani, our medical advisor, who has been instrumental in curating this program for all of us today.
There we go. All right. Thank you so much. Welcome everyone for being here. Can everyone hear me okay? Okay, great. So as Wendy mentioned, I'm Dr. Sheetal Ajmani. You all have received multiple emails from me. Thank you for your presence. Thank you for being here. We couldn't do any of this without you. This is an agenda. You have the agenda and the program at your seat as well. But we're going to start, I'm going to give an overview of what social prescribing is, to set a little bit more context here. Then we'll have a keynote address by Larissa Trinder, who is here with us from New York. We have lightning talks featuring local experts who are already in some way addressing holistic care for patients and communities. Then we'll have a little break, followed by some breakout sessions and group discussion. So really our goal with today is to have this for everyone to come, everyone in this room to engage in these discussions, to come away from today with having some clear practical takeaways so that we can actually begin to move this initiative forward within our communities together. And we realize it takes more than us to make this work. It really is a cross-sector collaboration that is required, and I'll go into a little bit more of that. But before we do that, I thought, why don't we just take a couple of breaths together? So, if you feel comfortable, just find a comfortable position in your seat, maybe with both feet on the ground. If you are comfortable with meditation and feel comfortable closing your eyes, go ahead and close your eyes now. If you don't feel comfortable closing your eyes, that's fine too. Just keep your gaze soft, maybe looking at a spot on the table just below you. Find a place to rest your hands on your lap or on your knees. Take a moment here to just notice your feet on the floor. You have arrived. We all took different routes to get here. But now we are all here together in this space, in this beautiful location at 4 Kids. So taking a moment to notice your feet on the floor, grounded here in this time and space and place. And then begin to now bring your awareness to your breath. Just noticing your inhale and your exhale as your breath flows in and out naturally. Breathing in and breathing out. Taking a moment here to connect with your very own breath. Your body's natural rhythm and flow. Letting go of any judgment. Letting go of anything that may have happened earlier today or anything to come. Knowing there's nowhere else you need to be, you have already set aside this time to be here, to gather together in this space, in community. Continue for another few moments, just noticing your inhale, noticing your exhale. At the end of your next exhale, just release. Begin to release this awareness from your breath. Once again, noticing your feet on the floor, coming back to this physical space. And whenever you feel ready, gently fluttering open your eyes. Now let's begin. As I mentioned, I would like to give an overview of social prescribing, what it is, where it came from. This is the topic that has brought us all here together today. So I want to start off with some definitions. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. So this is pivotal because much of how our healthcare system runs today is we are really focusing on sick care, right? But the World Health Organization defines health as encompassing so much more than that. It is actually a state of complete physical, mental, and social well-being, right? So not merely the absence of symptoms, but actual well-being in your day-to-day life. There's also this thing called social determinants of health. Social determinants of health are the social, environmental, and economic factors that affect health. The CDC, the Centers of Disease Control, have identified 5 key domains to the social determinants of health. These domains are economic stability, community and built environments, education access and quality, healthcare access and quality, and social and community context. Now, studies have shown that in clinics where healthcare providers are screening for social determinants of health, the most common social determinants of health that are screened for are related to economic stability and community and built environment. So things like poverty, food insecurity, those are the top, and housing stability are the top social determinants of health that are actually screened for in clinical settings. Social and community context is the least screened for in healthcare settings. Yet we know that there is a protective effect of social support, social cohesion, and community engagement on overall health and well-being, including arts, culture, and nature. So at the Benjamin Goldberg Foundation, we started with a focus on arts and health. And arts is now considered through, specifically as a subcategory of the social and community context, a social determinant of health. And so social prescribing is an approach that ultimately increases accessibility to these resources to address these social determinants of health. Social prescribing specifically is defined as an innovative approach that connects individuals to activities, groups, and services within their communities to address these practical social and emotional needs that we know that research shows impacts health and well-being. So I want to go over the CUSP framework. So this was published last year in 2023. There was a study that was looking to tried to come up with a uniform definition of social prescribing. And so this is a sort of abbreviated version. They came up with a long definition and a shorter version. So this is the abbreviated version of that definition. And I'll also go over the framework that they identified. So they defined it, they came up with, through this study, a definition of a holistic, person-centered, and community-based approach that addresses health and well-being by bridging clinical and non-clinical supports. So those supports that you get in the office or inpatient clinical settings, as well as non-clinical supports. So those community engagement sort of supports that we're going to talk about a bit more today. Designed to mitigate the impacts of adverse social determinants of health and health inequities. So they outlined a framework for this, for social prescribing. And this is sort of the 4-step framework that they identified. One is that there's a trusted identifier. So a trusted individual within either a clinical or community setting identifies a person's non-medical health-related social needs. So there's someone who identifies the need. Then there's the connection process. So the identifier connects this person, this individual, to non-clinical community supports and services through what is known as a social prescription. Then there are connectors. So the role of the connectors. Now the identifier may connect the person directly or connect the individual to someone else, a connector such as a link worker or a social worker, who then links that person to community supports and services. Then there's monitoring and reporting. So this is what helps ensure wraparound care, right? So the connector monitors the person's response to these services and reports back to the identifier. So ensuring that complete wraparound care from the referral to the feedback and the response to that referral. So what else do we know about this? Why even do this? So in the UK, the UK is the first country that started the social prescribing initiative within their healthcare system. And what they found, it was in response to exactly what I'm going to show you here. In response to, they realized that 20% of general practitioner visits were for non-medical reasons. Things like patients coming into the ER on a Friday night, consistently every Friday night, because they feel lonely. And that's the only place where they feel cared for. Or patients coming into the outpatient clinic for headaches related to, that could be addressed by addressing their social needs. Yeah? And what the UK, what this really started with was the UK was seeing a strain on their healthcare system. Much like we are here in the US, healthcare staffing shortages, right? Increased volume, workload demand, right? And so they were looking for a way to address the strain on the healthcare system. And so when they realized that 20% of general practitioner visits are for non-medical reasons, this led to the development of this social prescribing pilot, initially a pilot program. But now it is built into their medical system. So in the first year of a pilot social prescribing program, these non-medical visits were reduced by 53%. Wendy and I had the opportunity a few months ago to speak with the director of a social prescribing program within the UK, who shared with us that from his experience from the town where he manages the social prescribing network, most of the referrals were related to mental health, social isolation, financial, housing, and for caregiver support. So that's great. That's the UK. And we also know that there's some version of social prescribing going on in about 30 countries currently. But what about here in the US? So I want to talk about this pilot program, Culture RX. This is the first pilot program of social prescribing that was done in the US. This was a study that was completed in 2020 in Massachusetts. And they developed partnerships between community organizations and healthcare providers, where healthcare providers wrote prescriptions when they identified a need in a patient. They wrote prescriptions for their patients to engage in cultural experiences. These were at no cost to the patients. They were able to put in a referral and actually, put in for a specific cultural art experience. And what they found is that participants reported, so these are the individuals who engaged in those cultural experiences, reported that they enjoyed their experiences. They hoped and intended to repeat these experiences. They viewed these activities as benefiting their well-being. They noted feelings of reduced stress, greater enjoyment, relaxation, and more energy, and no adverse effects were reported. They also gathered feedback from the cultural organizations themselves, the community cultural organizations. They observed that participants demonstrated greater connection with others, and they noted an improvement in the mood of participants. They also gathered feedback from the healthcare providers. The healthcare providers putting in the referrals appreciated having a positive intervention to offer their patients. They felt like this partnership gave them additional tools to support their patients' needs. They noted a positive impact on their own well-being and work satisfaction. They observed that patients demonstrated positive effects in their self-esteem, self-efficacy, and mobility. They noted an improved physician-patient dynamic. Providers appreciated having another way to connect and communicate with their patients. And they also felt that this is not on the slide, but they also felt that often many of the interventions that they prescribe to patients are limiting in nature and restrictive in nature, right? Eliminate this from your diet, eliminate such and such from your daily activities or lifestyle habits. Whereas this was something that physicians and healthcare providers were able to offer to augment, to add in. And they appreciated being able to direct patients to specific cultural experiences within the community, as opposed to making general recommendations, right? As opposed to saying, oh, maybe you should take an art class. Actually, here is a specific place that you can go to take that art class. So what are some models for this? So kind of building off that CUSP framework, the image here, the graphic here is from the Art Prescription Field Guide, and this is adapted from an organization called Art Pharmacy, which is based here in the US, and are doing work in this area. So essentially a referral, right? So a healthcare provider, or according to the CUSP framework, it could be a trusted community member, identifies a need, writes a prescription. Then there's a connector. So in this graphic, it's a care navigator. In the UK, they call them link workers. It's a specific role within the healthcare system of a link worker who then meets with the individual for a longer intake. They're able to spend a bit more time with their individual to do a complete intake to really find out what matters to them. What are their interests, right? To then help match them up with an activity within the community that specifically identifies and matches their own interests. And then there's monitoring. So again, the care navigator or the link worker monitors the progress and shares that information with the referring healthcare provider. So implementation guidelines. So this comes from the World Health Organization toolkit. So the World Health Organization has actually published a toolkit for implementation of social prescribing. And these are the 7 steps that they outlined here. 1, conduct a situation analysis. Assemble a core implementation team. Develop an implementation plan. Map out community resources. Get everyone on board, so all the stakeholders, all the collaborators on board. Training the link workers, because that is a special role, right? For example, in the UK, they have a role specifically dedicated to that, and then monitoring and evaluation. So we here, right now, everyone in this room, we're gathered here together, and we're essentially doing 1 through 4 today. We are taking a look at our community, what we need, what the resources are. We're going to be doing this throughout our talks this morning, as well as in more detail in our breakout sessions, right? We hope that all of you will be part of our core implementation team. The fact that you're all here today is part of that. Coming up with a plan and mapping out community resources. So here today, we are literally working through these first 4 steps together. A few additional considerations as we move on. So there's also a field guide that was published not so long ago, an Arts on Prescription field guide, specifically looking at how communities can prescribe arts for health. And so some things to keep in mind: dose, duration, and frequency. So just like a prescription for a medication, right? How much, how often, how long, right? Strength-based programming. So this is looking at what is our community already doing that we can just build upon or create and adapt into the social prescribing model. Yeah, so really building on our community's strengths. Diversity, inclusivity, and accessibility. So important that we address these factors as well, right? We can write a prescription to go attend this art event, but if someone has transportation issues, we need to be able to address that as well, right? If someone comes from a community where they're not used to being in certain settings, or they feel like they may be looked at differently, we need to be able to address that. And then the innate framework for arts and health programs. So there was a study that was looking to identify key ingredients specifically for arts in health programs. This study defined arts and health as interventions delivered in healthcare contexts as part of healthcare referral pathways or with specific health and well-being outcomes in mind. And this framework identified 139 active ingredients categorized into 3 broad groups. These 3 groups were project, so looking at what is the project that you're going to do, and arts, what is the arts activity, what's the format, again, the dose, what types of engagement participants will have, people, the composition of the participants, how they interact and engage with the activity, and with the facilitators, in context. So again, the setting of the activity, right? The environment, the atmosphere, how the project is set up, as well as contextual factors and accessibility factors like I just mentioned, such as economic resources, transportation, recruitment, and the referral process. Funding, big question here. So there's no unified funding model, right? I mentioned that there's some version of social prescribing that is currently being used in about 30 countries around the world. There's no unified model for funding. In the UK, the NHS, the National Health Service, they have trusts that pay the link workers. And then there's community NGOs that support the training of the link workers and support the facilitation and coordination. Art Pharmacy, which I mentioned, the graphic that I showed you earlier, is a US-based for-profit company that has established contracts with insurance companies so that some insurance companies are now reimbursing for these services. They were first established in Georgia, and I believe they're up to working in 4 states now. And then grants. So the pilot program in Massachusetts, Culture RX that I talked about, that was funded by a grant. So that's a brief overview of social prescribing, hopefully giving you some context. And then we're going to hear from our keynote speaker, Larissa Trinder. We're just talking about names. So Larissa Trinder is coming to us from New York City. She is the Assistant Vice President of NYC Health and Hospitals Arts and Medicine Department. Within this role, Larissa is responsible for stewarding NYC Health and Hospitals collection of more than 7,500 works of art, the largest such collection in New York City, as well as creating and implementing programs for patients, staff, and the community that use arts as a tool in healing. She's a seasoned professional with more than 20 years in the healthcare field. Larissa has a master's degree in public policy. Before joining NYC H&H, Larissa was local here to Hampton Roads, working for more than 10 years at CHKD in philanthropy and creating programs to integrate the arts into the hospital system. She advocates for the importance of the arts and humanities within a healthcare system to advance patient health outcomes, enhance staff engagement, morale, and retention, and to empower communities. Welcome, Larissa. Thank you for being here.
well. Am I projecting? Okay. Yeah, I'm so excited to be here. This is just a really exciting topic, and thank you, Sheetal, for your amazing introduction. I think that you really were able to give a very distilled version of what social prescribing is. Thank you, Wendy and the Goldberg Foundation, for your friendship and for your work in advancing the arts in healthcare. It's just really been an honor, and some of my colleagues from CHKD that I see here that certainly were advocates as well when I was here. But I think we need to take a step back for a minute before we even get into the social prescriptive conversation, which is very much a part of my presentation. But I want to talk a little bit more about having an art strategy in healthcare and what that looks like. And I'm going to obviously share the one that I'm a part of, but I do believe it's extremely replicable and is one that can be scaled and should be scaled to be included in every health system in this country. So I am told, Jennifer, that I have So I have about a 5-minute video I'm going to share with you that gives an extremely broad stroke of how this department works at health hospitals.
All people's mental health, all makes people enjoy a workplace. Coming to work, feeling good about your job makes you a caretaker, want to have patients, happy doctors, happy nurses, happy social workers. New York City Health and Hospitals is the largest municipal hospital system.
We need to support our staff with coming from communities that are doing a lot of the same trauma, right, that our patients feel. But if you have the stress of working.
We were so excited to partner with New York City Health and Hospitals. We've done hundreds and hundreds of classes throughout our partnership. They're working in crisis every single day. So give them an opportunity to pause in their place of work. Very powerful. The doctors, the nurses, the administrators see greater possibility. They're seeing themselves better and how they respond to the world.
There's a lot of science behind art observation, deepening empathy, creating team cohesion, and so we really have been using these workshops as a way to help these teams communicate with one another, share their experiences.
One of the programs we have with New York City Health and Hospitals is our well-being concerts. We wanted to create a concert that would really try to maximize the positive well-being benefits that can happen in a communal live music setting.
I think that's part of my job, right? It breaks up kind of meetings, kind of taking a moment for my team, for myself, to really heal, to really center, to have things flow through the communities.
We're caring about people. We're caring about our individual mental health, our physical health. It's about empathy, and it's about coming together and being professionals. There is a really powerful connection between our groups.
I'm really excited to be part of the mural project and specifically working with the hospital where I got to paint a mural in collaboration with the board members and the doctors and patients. We collaborated to come up with the idea and design the mural. It's just a really joyous experience. Like any other, I think I'm really happy to have my hands in the project.
I love the new roles. I love the idea that patients and staff were involved in painting that. Clearly that made them part of the art and it increased the sort of therapeutic value of it.
We are now part of a global study with the Jameel Arts and Health Lab at NYU, the World Health Organization, and Culture Runners, thinking about what are the ways that large-scale murals can impact public health. The World Health Organization now says that participating in arts and culture is a health practice. I think we're all learning about what that means together. We're researching together. We're experimenting programmatically together. Arts and Medicine for Carnegie Hall is a key partner in doing all that.
The Arts and Medicine Department was established with the support of the Lorraine Tischel Illumination Fund.
The Illumination Fund is partnered with Health and Hospitals in the most unique, exciting, and fun project
It makes people happy, it breaks down barriers.
Arts philanthropists can impact healthcare. Healthcare philanthropists can impact the arts and increase access to the arts. And so there's this convergence of value that the hospitals do on their own, and that's where philanthropy can play a role.
Philanthropy is all about building bridges. It's all about that small amounts of money can have huge magnifying effects.
I really hope that this program is a model for hospitals and cultural institutions far and wide. A program like this really nurtures our spirits and our souls in really important ways.
Art makes each of us feel sort of bigger and better than we are. It pushes us, it expands us, it magnifies us.
The impact up to this point has been beyond anybody's wildest imagination and expectations. This is just part of how we take care of our bones, part of how we create an environment for our patients with listeners.
Going forward, I really want to see this merging of a mission about art and a mission about health, and all of the ways that we can bring those two things together.
Microphone is not our friend today. So a big thank you to Jennifer for holding the mic. So, that obviously was a very broad stroke of what we're doing at New York City Health and Hospitals. And, there's so much to talk about today. And I kept slicing this presentation down because I really wanted to try to be strategic and imparting with you how to think about this and also how to, again, consider scaling this, obviously, in Hampton Roads and then beyond. So we're going to just briefly go through a little bit more about the structural orientation of arts and medicine, and then talk a little bit about addressing loneliness and disconnection. Is it like June? Yeah. And then obviously we're going to get into talking about art and wellness enabled care models, and then a lot of what Sheetal talked about already, which was looking at who's already in your system that can take on, I say additional work, because they should have additional pay as well, but we can get into that. And then, really more importantly, developing a very strategic civic engagement strategy with your museums, with your other cultural assets in your community, in order to really build upon what you want to bring in to your patients' families, and by the way, staff, because the majority of what I do and what we focus on is our 42,000 staff. And we recognize that if our staff are cared for and feel valued and loved, then that will correlate with all these other things, with better patient care and engagement with the community. And then, of course, while we're here today, really talking about how all of this can help us build a case for social prescribing. So you heard a little bit from my CEO, who's just a brilliant, amazing leader. So I won't go through all of this, but we are the most diverse hospital system in the world, with over 180 languages represented. There's 11 acute hospitals, 5 long-term care facilities, and over 70 clinics in all 5 boroughs of New York City. And we, just like CHKB, we don't turn anyone away, regardless of their ability to pay. We have the largest amount of people experiencing homelessness, mental health, and asylum seekers obviously have become a very big issue in New York City, and then just all sorts of other things. So I feel it's a really great example and orientation for why you should be having an arts strategy in the largest public hospital system in the country. And if you can have it, I hate to say this, but I'll say, if you can do it here, you can do it anywhere. So the arts and medicine, I won't read through all of this, but the vision for us really is to think about internal evidence-based programming and external civic engagement and cultural partnerships, which I'll talk a little bit more about later in the presentation. Just really briefly, we have a myriad of different kinds of offerings within the department, but it's less about the actual offerings, and it's more about a high-level strategy and ideology, thinking about how we are going to be supporting the mental health of our communities. So a little bit of history with the Arts and Medicine Department. One, because it's actually really fascinating, but two, because I think it sets an example for a culture for the arts. So if a health system does not have a innate culture for the arts, it's going to be harder and harder to establish things like social prescribing. So it's sort of like these incremental steps that need to be established, and I do think that, at CHKD we were making some movement in that direction. So the department was, not department really, Arts and Medicine didn't even exist, but the art collection, it's about 7,500 pieces. It started during the Works Progress Administration in the 1930s, and while there was no science back then, I do believe those were really early exemplars of how the impact of large-scale murals can really affect your public health outcomes. And these murals, we have dozens of them in our system, they were brought in really by FDR to not only for a practical reason to just hire artists and pay them during the Great Depression, but also as a way to really create distraction in the hospital. So we had them in all sorts of things, in nurses' lounges, in long-term children's tuberculosis wards, all over the city, and many of them are still there. And Harlem Hospital actually has the largest number of them in one setting, so if you're ever up there, I'd be delighted to show them. So legend says that in the 70s, for some reason, about 3,000 works came in. There was an advisory board at that time that was comprised of different creatives in the city, some philanthropists, and a lot of our pieces are from really famous artists, but at the time, those artists, the reason we have some of those pieces is because those artists weren't famous then. And so they were working at different places in the city, they were being educated there, and they would donate and just give a lot of their pieces to the hospital system, so we're very grateful for that. And then the 70s and 80s, and Asa and I were talking a little bit about the Percent for Art program earlier, which says that 1% of your capital design budget needs to be directed towards art and design, and I think that was implemented here in 3 places in Virginia. It's Norfolk, Roanoke, and Richmond, and I think it was 2002 that Norfolk established that. So it's something you have to kind of advocate for because it's not necessarily going to happen automatically, but it's there, and it's a way to make sure that any kind of public pieces that you're working on can be covered by capital budgets. So anyways, in the 1980s, we received more pieces. Long story short, in 2018, Lori Tisch sort of was thinking about how to recreate her foundation, and she wanted to have an art and health kind of angle, and was thinking about, she's very involved in the arts in New York City, and she thought, who needs help? And she thought that obviously the public safety net would, and she really was an early visionary in kind of establishing this idea. The important thing here is that the Arts and Medicine Department had a structural decision by leadership to embed my department into the Quality and Safety Cabinet. So I sit among 14 other entities that look out for the culture and safety of the entire organization. So I have the head of infectious disease, the head of NYPD, the head of data and analytics and IT, and a bunch of clinicians doing all sorts of work. And the 14 of us are these departments are really set to do that. And I think that that's so significant because it demonstrates advocacy from the top that says, this isn't a nicety, this isn't something to bring in adjacently, this is an essential department that we recognize can be part of a larger strategy to support our staff because we want to keep them here. So anyways, I won't go through the rest of this timeline because I want to be mindful of your time today, but the department was established and we're doing a lot of work continuing to move forward. So again, this is sort of what I just said. I think the most important thing here is about a year and a half ago, we established a research and evaluation arm that we've continued to grow because I think it's really important in this space, particularly when we talk about social prescribing, is having an avenue to be able to measure this. So much work, particularly in the arts, is non-quantitative. It's hard to prove what we all in this room intrinsically know makes us feel good, being in a beautiful place like this, being around beautiful art. We know that makes us feel good, but how is that measured? So we recognize that if we didn't measure this and we didn't start evaluating it, we wasn't really able to explain to my funder what the social impact was, explain to my CEO that yes, you have a huge ROI in having this department, and also being able to contribute to this larger discourse that's happening right now. And we are at the tip of the iceberg with what's going on with art and health all over the world. So this is a very critical moment. I commend Wendy for bringing it here. So one of the things we're measuring very specifically is the MBI, or the Maslach Burnout Index, and we're looking at this with our staff. 300 to 400 physicians are committing suicide every year still. That's one a day. And so thinking of ways that we can make sure that their mental health is supported is really something that we've been evaluating. And I'm happy to get really granular with this with you at another time, but there's a lot more here that really can help reinforce these models. So social prescribing. So I just sort of want to very briefly go through all of the images, by the way, are from our collection, which is really fun to put together. So, what creates well-being? What's the evidence for the arts? What is this sort of interdisciplinary approach that Sheetal was talking about? Behavioral health is a huge opportunity. Those departments are really the aperture for social prescriptive modalities. And then what are your community and cultural assets and your civic engagement strategy? As Sheetal also said, who pays for this and how does that look? And there's a lot of different ways to do this. There's not just one solution. And then policy and activism. So what creates well-being? When we think about everything, and I always talk about this, everything that brings us joy in this life, I would say 99.9% of it is either linked to the arts or to nature. And if those two things are taken away from you, then your mental health will absolutely be impacted. So you can go and get your Lexapro, and you can go and get your healthcare, your clinical interventions, which are extremely important, and don't think I'm even intimating they're not. But what are the other things that can bring us joy and help bring us together? And so there's probably a million more things we can put on here, but I just put down things that brought me joy. So we had talked a little bit about what the evidence is for the arts. And last week it was so exciting. The NYU Jamil Art and Health Lab is about a year and a half old, and they are doing incredible work, and they're part of our partnership on the home study there is the hospital neural evaluation study that we're involved in. But they put together the United Nations General Assembly Healing Arts Week. It's still going on actually this week. And they brought together all sorts of thought leaders, and this was an amazing panel discussion with the chairman of the National Endowment for the Arts, the beautiful Renee Fleming, the head of the World Health Organization's Art and Healing. All sorts of different thought leaders coming together to think about how are we going to prove this to the world, basically. So at New York City Health and Hospitals, we have all of these different things that we're thinking about, and I'm not going to say it long on this page, but Sheetal also went through a little bit of this. But who are all the players in this game? Who do we need to be thinking about? And then within each of those, how are we digging deeper? So internally, there's all sorts of different people. There's the providers, there's the patients. As I mentioned, behavioral health is really an important lead to get involved. There's community health workers, there's creative art therapists, there's social work. There's link workers, as you said, there's peer specialists, there's a lot of different titles for different roles, and it just depends on the health system. None of them are right or wrong, it's just you have to think about what your health system is and who's there already. Chief Wellness Officer is really important. I work very closely. We have very different strategies. He and his team really are looking for therapeutic outcomes, so they're using LCATs to really achieve actual clinical outcomes, whereas we are more using arts as an intervention or as a support. But we absolutely cross paths and do a lot of work together. And then I mentioned data analytics. There's a lot going on related to social prescribing. We have IT and AI strategies right now related to zip coding, social determinants, but I'll talk about that in a minute. And then external cultural partners. Who are the museums that are involved? What are their education departments doing? What are their civic engagement platforms and mission? And how are they viewing their responsibility and mission to be supporting public health? And the best partner for that, and I know that the video showed the Whitney and the Brooklyn Museum, but the most amazing partner has become the Museum of Modern Art. They have an incredibly new and really authentic and beautiful civic engagement platform that I'll talk about in a minute. Artists. Your artists are probably the most important thing here. They are, I say, they are like pieces of hospital equipment. They are like the doctors. They are coming in and are able to think about solutions. They help with communication. They help illuminate really complex things that are happening in the world, whether it's, we used artists in residency last year to highlight the work of our hospital violence prevention programs, and it was very successful. We did a lot of different things. So really thinking about who your internal folks or connectors would be, and then who your external are. Of course, parks and recreation is always an important one. So again, sort of duplicative, but who's doing what in the system? I'm finding a lot of recent luck with creative art therapists who are reaching out to me now more and more often saying, hey, I'm a creative art therapist in the Bronx and I have a patient who's really interested in quilting. And so identifying who in the Bronx is like making quilts in her apartment, they could be like a potential connector and would want to be engaged in this kind of activity, and how can we get others involved in it. Creative art therapists and community health workers are also, I just said creative art therapists. Community health workers are another one that I'm going to talk about in a minute, because today, CHWs are becoming like really significant in healthcare paradigm and healthcare models. Their role became a little bit elevated during COVID, particularly in New York City, because they were seen as, they just needed extra bodies. There was so much going on then, and they ended up like helping. So basically a community health worker at its base is there to just sort of connect you just with different resources like food and housing, like very basic things. But they've now kind of grown, and you'll see I have another very brief video to talk about them. They are really starting to link people to culture and our experiences. And it's just been an amazing evolution. So addressing the loneliness in public health, our own Vivek Murthy, our U.S. Surgeon General, has come out not only with one, but maybe like 3 reports now talking about how loneliness is an epidemic, how it's just as dangerous as any kind of physical chronic disease, and it's really impacting all of us. And so I know that this is something the current political administration they've been thinking about, but something that really needs to become more of a public policy focus, which is how we can deal with this loneliness and disconnection in the society. We could obviously all have another whole day, and I'll probably try to figure that out. And so one of the ways that we're doing it at New York City Health and Hospitals is, again, growing community partnerships, understanding what the cultural assets are in the community. And I don't just mean the Chrysler, and I think I saw Allison, the Mocha. You have these incredible museums here that you should certainly be working with, but also just some of these other local artists that really have amazing skills and amazing things to offer that could be tied into these kinds of strategies. And then educating, of course, the current teams we keep talking about, just sort of, and it doesn't have to be this like really intense education. It's just almost something like we're doing today, to just say, listen, like this is something that we should be doing, making sure that you have buy-in from leadership. And that's one of the trickiest pieces, and I was saying this to Camille earlier, is making sure if you don't have buy-in from leadership and they don't understand what this is and how it's working, it's going to be a lot harder to develop a social prescribing model. So I think like it's sort of like, again, these incremental steps. We're working on kind of putting together a toolkit around this, but I think that basically having some sort of way to advocate for this so that leadership understands it and buys into it is really important. Then building the resource and tools for staff again is very complicated, not like intellectually complicated, but it's sort of complicated depending upon how you do it. So you had mentioned Art Pharmacy, that is a for-profit. We've chosen to not do Art Pharmacy because we don't want to do a for-profit model. So we are working on this internally on our own. We are creating an AI, as I mentioned earlier, sort of way that our LCATs can quickly use AI to put in our zip codes that you can have access to if you work in the system, not a HIPAA violation. You can understand which communities are in greater need based on their social determinants, and then connect them to the assets that are in that community. So there's a lot of different kind of innovation and creative thought going behind how to develop this. And again, it's sort of, it'll be different for every community. And of course, always planning a model that is equitable and inclusive, making sure that the end users really are a part of this conversation. We bring in the staff all the time to ask them and the patients, what would work and what they're looking for. And that example of the woman making quilts in her apartment in the Bronx is a true one, because that's what a patient really had wanted. So we figured out how to make that connection happen. And then, of course, this food on prescription is just a quick one. This wasn't my department, another one. But in 2022, they basically did a study where they were delivering fresh produce to infants, newborns in the Bronx every Monday. Would come to their front door, and they obviously did a control group. But they did this for, I think, 6 or 8 months. And, you know, the results of what you would think is that even internal brain development and other sorts of things were happening. The parents weren't stressed because they weren't trying to get food or try to figure out how to pay for fresh food. And so, you know, this, and I have this, if anyone's interested in reading the whole research study, but it really set a good example for me, frankly, and the system to be looking at, like, hey, we've done this with food insecurity, we can do this with art and culture too. So looking for precedents and other things that might have already been happening, that might have already occurred is kind of important. So funding sources and models. So obviously philanthropy, I'm fortunate, Lori Tisch is an amazing advocate, you know, and there's a lot of different ways to do this. I think that the ultimate goal would be a sustainable model. In New York City, there's a waiver called 1115 that it's just for food and housing right now, and we're working on, it'll take forever, but we're working on how to add to that waiver an art and cultural component, so that when they go to the woman making clothes in the Bronx, whatever that ends up costing gets covered by their Medicaid. So there's some definite nuance in the healthcare and in the insurance industry that we looked at, particularly as it relates to Medicaid and Medicare. And then we talked about Massachusetts. Rhode Island and California are also really putting together some really interesting state art councils that have very interdisciplinary approaches. So Rhode Island has brought together, for example, Brown University, Rhode Island School of Design and their museum, and Newport Art Museum, I believe, and Lifespan, which is their healthcare thing. Anyways, and some others. But they're basically all coming together to think about at a state level, how can we use the arts and make sure we are, you know, impacting public health and affecting public health outcomes and making people feel connected. So there's some pretty interesting things happening. So again, this is just brief. There's all sorts of different ways you can do the referral process. The way that I just mentioned with AI is one of them. But the other thing LCATs have been doing, they haven't, if you have, and hospital systems all have these intake forms. So doctors are really busy. They have, like, I don't know, you tell me, we should come, like, you know, 10 minutes with each patient. So we certainly didn't want to create another system that was going to be cumbersome for them to have to, like, oh, now can you ask them if they like ceramics? And so we piggybacked onto they're starting to call it humanistic charting, which is really this an intake form that's already in place that the clinical provider can read. And we piggybacked 2 simple questions onto it that I'm happy to share this template with everyone as well, but you know, that are very strategic in sort of understanding, and then the provider takes that in, and then whoever it is, the social worker, link worker, community health worker, then has a little bit more knowledge, like, oh, Wendy likes to do ceramics or something. So it's, I just dumbed it down a little bit, but it's definitely something to think about to add on to something, again, that already exists. Instead of reinventing the wheel, health systems are incredibly slow in change, and if you do something that's like Trojan horse it, you're going to have better outcomes. And then how to track it, you know, we're QR coding things. We're working with our IT team on thinking about this, and again, what already exists. So one of the last things I really wanted to share with you today was, again, I talked about the Museum of Modern Art. Museums, and Allison could talk about this, have amazing exhibitions with very famous artists, or not very famous artists, but talented artists, and they come in with their narrative. And Latoya Frazier is an extremely well-known artist and activist who did a recent exhibition at the MoMA highlighting a lot of things, but one of the main things was the community health workers of Johns Hopkins. And she had a whole room with IV poles, and on each IV pole was a photograph and then a narrative from the community health worker talking about what they did in their community. It was so empowering and interesting So I've been working with Leonardo Bravo, their civic engagement person in the education department, on how can we partner on this, because we have community health workers and we want to think about this. We have 240 community health workers in our system. So the first thing we did was last summer, LaToya had a private tour of her exhibition with 40 of our community health workers. And it was 2 hours where a pin could have dropped because they were so engaged in this workforce felt so empowered by this experience. And then we ended up having a recent panel discussion happening this fall, in early September, with LaToya, with our head of population health, another physician. And it was really just an amazing opportunity to think about, and again, empowering this workforce, but also another avenue or another way that arts and medicine departments can really highlight strategic priorities of the system and highlight strategic workforces and elevate them to have a little bit more of a light shown on them, because they're so often overlooked and taken for granted. So this is the video of the community health workers. I don't know if we...
Do we want to try this again?
They send me patients from Bronx, Queens, Manhattan, Brooklyn, Providence, I go everywhere. Whenever they want to see me, call me, I'm here for them. My name is Antagracia Reyes, and I'm a community health worker. A community health worker helps the patients navigate the health system, to guide them, to empower them. We are an army of love, of compassion, and of service.
A community health worker is someone that assists patients, builds a trusted relationship with them, will step in to fill in the gap and be there for them and walk them through whatever it is that they need. It could be a patient not being documented, or maybe not showing any type of symptom, or not having an ID. I had this patient, he is visually impaired. He did come to me asking for assistance with preparing his meals. I was able to connect him to food delivery for him. And now he's receiving meals to his home, allowing him to live a healthier lifestyle, which is what we're promoting in my program.
My name is Larissa Trinder. I'm a community health worker supervisor here at this hospital. There are a couple of programs for different kind of population. We have the one for pediatrics, and then we have for adolescents. We have for safety net, those patients who are having issue with the housing, and then we also have a behavioral health team. We want for our patients to connect them better with the provider, to help them better understand their health needs, to help them to schedule their medical appointments, to help them better with medication management to make those health goals possible.
The origins of community health workers are typically in low resource areas where doctors may be hundreds of miles away. We found that the community health workers are able to bridge the gaps between doctors and nurses and other health professionals and our patients. I'm Dr. Mitchell Katz, and I'm the proud CEO and president of New York City Health and Hospitals. Many of the patients of health and hospitals struggle with a variety of social needs.
Some patients are unaware of the benefits. Some patients can't get to the benefits. They can't reach the benefits due to psychosocial issues, physical, emotional, ambulation difficulties, and that's what we're there for.
Can you imagine receiving a phone call from a total stranger asking you to identify yourself? You feel a little nervous about it. I have to build the trust. I have to make them comfortable. I have to build a relationship with empathy and care with the patient and the community. I call them for outreach, and I will introduce myself, introduce the program, services that I will offer. Patients start to open up and share their life story, or how they were brought up, or what are their struggles.
Those are my babies, and I'll never give them up.
You have to know your community. You have to go to the community. You have to work for your community. So without knowing your community, you never can negotiate with community health work.
community health workers are a proud and energetic group. They represent all of the diversity of New York City and are therefore able to be the best possible advocates for our patients.
We come from open hands, open hearts. So when those patients say, "Hey, God bless you," that's how we keep going.
So, I love that whole example of the community health worker, how we were able to work in highlighting them, how we were able to connect with the museum of modern art to really be thinking about these larger, more complex challenges. And all of that work really makes it a lot easier to have not only a very distinct culture for the arts, but also really set the groundwork for building social prescriptive models. And so these are sort of just a few last minute things I wanted to leave you with. So, some of the questions to sort of ask are, what are the current programs that are in your health system? How can those already, with what they're doing, be contribute to social prescriptive models? Making sure that they are integrated with what the wellness objectives and goals are. What is the current culture for wellness in your organization? And, that's why, what obviously works for New York City is not going to necessarily work here or in other communities. But so thinking about what are those things that make your community and the objectives already there. And then, probably most important is building these relationships with education departments and museums, building relationships with other artists, doing collectives. And I know there's the Vibe District, the Neon District, and a lot of stuff is happening here. This is a very culture-rich area and really a great opportunity to sort of have something like this because you have a lot of these players here. You have academic institutions, you have healthcare institutions, you have world-renowned museums, and you have really a lot of engagement by local artists that are involved in this. So I think there's just a lot of opportunity here. So anyways, happy to expand more on any of these things. I know that was a lot, but thank you for hearing me today.
Thank you so much, Larissa. Next, we're going to have our lightning talk, so featuring 3 local experts who are already leading the region in addressing holistic arts and health. So up next is Asa Jackson. Asa Jackson is an artist, curator, and director. As a multidisciplinary artist, Jackson's work explores the cross-section of textile from various countries, people, time periods, and personal histories. His works are often anthropological studies representing the lives of myriad people, their collective and individual stories. By cutting and sewing fabrics together, Jackson metaphorically mixes cultures, time periods, people, and places into unified works of art. His work is a part of various prominent collections, including the Virginia Museum of Fine Arts, the Capital One Corporate Collection, the Rockwell Museum, the Mint Museum, and the Haskell Family Collection. Additionally, he is the co-founder and executive director of the CAN Foundation, a not-for-profit arts organization in Newport News, with a focus on building sustainable careers for the creative class and engaging communities through artist development, arts education, and public projects.
Good morning, everybody. Good to see some familiar faces and so many new faces. Thank you, Wendy and Sheetal and Jennifer, for inviting me. And Larissa, I really enjoyed your talk. So far this morning, I've heard so many wonderful things that I'm going to sort of double back on and touch on. Let's see. I wanted to start, though, with a personal anecdote. I think in reflection of social prescribing over these coming months, preparing for today, I was thinking about, has there ever been a time in my life that I've had social prescribing directly without knowing it? And I think the first example was probably when I was a freshman in college. So bear with me for a second. So I maybe towards the end of my freshman year, first semester, I was struggling like many other, freshmen being away from home. I was going to school in Boston. I'm from here in Hampton Roads, so I was far away from family, far away from friends. And I remember having this conversation with my mom one day. Maybe this was maybe towards the beginning of exams. It was December. And I called my mom. I was in Barnes and Noble. I was looking at books. It was a fun practice of mine. And I came across this one book that had the sort of cross-section of a brain and all of these sort of elements and aspects of a brain. So I picked it up and read the back cover, read the introduction, and found out within a few moments that the book was about a practice called pranayama. Is anybody here familiar with pranayama? Okay, so pranayama is breath control, or control of life force, as it actually is translated from Sanskrit. And so I have to thank Sheetal for giving us that little breathing exercise, because it sparked this memory for me. So I picked up this book, I read about it, and at the same time, simultaneously, when I called my mom at this period, I was struggling socially. I think being in a place, a new city, a place like Boston, is at the time had 63 colleges right in the city, with all the surrounding colleges as well, like Harvard and whatnot. I was struggling socially. To give a little bit more insight into that, at the time there were about roughly 35,000 students at Boston University, but only 111 of which were Black males. That was post-grad and undergrad. So it was not a place that I saw myself reflected often. So it was a big struggle adjusting socially. So I called my mom one day just to talk like we normally did. And I told her about this book that I found, because at the time she was struggling with obesity. When I graduated from high school, she was weighing about 320 pounds. And at the time, we were just talking. I told her some of the issues I was having with, friend groups and things like that. And then I told her also about this book. And so I gave her these breath exercises to practice. And she told me, why don't you go to your local art supply store, and buy some canvas and some paints and get to work. Because I was in love with arts as a child. I excelled in arts in high school. But after high school, I didn't know if I wanted to be a full-time artist, so I kind of put it down into my freshman year, and I thought maybe it was something that was for my youth. But my mom encouraged me to pick it back up as a way to just soothe myself, which it did. And quickly, I think within a day or two, I was feeling much, much better just having canvas and my tools that I was used to growing up in my dorm room. And simultaneously, the exchange of giving my mom breathing exercises. So she took those breath exercises, and then she followed up. She got with a doctor who was an Indian doctor at Hampton University at the time. And he was actually teaching a class on pranayama at the university. And so she got with him, she learned more, and within a year of me telling her about these breath exercises, my mom she went from 320 pounds to 130 pounds in 1 year. Not drastically changing her diet, not exercising any more than she normally does, but simply doing breath exercises with a group of people every day for a year, right? And I know I'm here to talk about the arts, right? But I want to speak to this just a little bit because, so maybe about a year ago, I came upon these seven basic needs for all humans, right? And these basic needs are sort of in order of life and death, right? How deeply we need them. And the first need is air, right? Everybody needs air. This is something that we can't exist without even for 2 to 3 minutes, right? The second need, so I don't forget, let me just refresh myself, is water, right? Can't exist without water for a few days, right? The third is sleep. I think without about 7 to 9 days, the body perishes without sleep. The fourth is food. I think without 2 weeks of food, the body perishes. The fifth is shelter, some form of body regulatory temperature. So even if you're homeless, the need to regulate your body temperature is the fifth need. The sixth need is relationship. So as humans, us being social, to have relationship with others, but also, even if you don't have access to people, to have relationship with pets or plants or just your surroundings. And the seventh necessity is to create. And the way this was broken down to me is that if you're not doing any of those needs consistently, you're actually contributing to your death. So thinking about the first need, breath, and the last need, to create, I think are my personal journeys around social prescribing. So to get a little bit deeper into what I do as a profession and how it relates to today's topic, yes, I'm an artist. I am the co-founder and executive director of the CAN Foundation, which stands for Contemporary Arts Network. We founded in 2015 and have since been primarily known for artist residencies, exhibitions. We manage 3 exhibition spaces around Hampton Roads, 2 of which are in Newport News, and 1 of which is in Norfolk. But we've partnered with organizations all over the region and beyond for the extent of our existence. So thinking about a holistic lifestyle, a holistic community, the reason we founded in 2015, myself and other artists, friends that I grew up with and came to know as an adult, were all recently back in Hampton Roads at the time. And thinking about our trajectory within the arts in this community and, all the gaps. So we came together to form this 501c3 to sort of help ourselves and help other artists find their path of sustainable careers. And looking at that path, looking at this framework, or developing a framework rather, we looked at 2 key examples, one of which was the WPA, which is a very historic funding project for the arts in this country, which in my opinion led to the United States being the leader in the arts almost 100 years ago. And the second were 5 key points of sustainable arts communities, which was laid down by an individual named Walter Hopps in the late 50s and early 60s. He was a pioneer of the Los Angeles art scene. And so those 5 key elements that lend itself to a sustainable, creative environment. I'll run it down kind of fast and then I'll give a little breakdown. Number 1 is artists and globally competitive artists. What does that mean? Art that you can take out of one place and place it somewhere else and it still holds up in value, right? Number 2 is places and spaces to show that art as often as possible, the best possible. What does that mean? That means places that elevate the work and can be seen and understood in a way that is elevating. Number 3 is documentation around what's happening. Documentation because in the art world, there's a term called provenance, which is sort of the who, what, when, where, how, and why that makes something what it is, but this is how we determine value. So the more documentation there is going backwards, who made it, when was it made, why was it made, how was it made, where was it made, what was going on in the area at the time, who does the artist know, where they show. These are all the things that give valuation to a work of art or an artist's history. But also documentation sort of pushes things forward as a PR mechanism. The 4th key point for sustainability is museum or some sort of industry buy-in or tie-in. And that usually when you are in a community, like for instance, the Mocha or the Chrysler, for instance, what happens on a subconscious level for a lot of people when they walk into those spaces is that they know that usually everything on the walls are spoken for, extremely important, valuable not only to the community but to history. And if an artist has made it onto those walls, they are usually a part of history already, a part of art history, or on their way. So there are all these subconscious associations that lend to sort of value proposition. And then the 5th point is the patron. And the patron is anybody who spends $1 on the art. arts. This could be all of us, people who listen to the radio or have iTunes or watch movies, but it also could be the person who goes to the local show or buys a print from an artist, or the government that funds the 1% for the arts, or the State Arts Commission, of which I was the State Arts Commissioner for 5 years, that gives grants to museums and nonprofits. So all of these functions are what make the arts community thrive and what allows artists to thrive and arts organizations within that fold. So the art, the spaces and places, the documentation, the sort of industry or higher level stamp, and then number 5 is the patron. So how does this play on us? So I want to give some anecdotes. I want to speak a little bit of our work, and I want to start with the first project that I was actually a part of coming back into this community in 2010. There was a community, and I'm sure a lot of you were around at that time. In 2010, this was prior to the Vibe District, this was prior to the Neon District, and in fact, there were no arts districts in all of Hampton Roads at this time. In 2010, I was selected as one of 4 artists to participate in a project called Hampton Roads at Campus, which was spearheaded by the Chrysler Museum, a small cohort of community leaders and activists within the Norfolk, downtown Norfolk neighborhood, as well as a defunct publication called Alt Daily at the time. Put together this project, and we beautified a location called the Zeds Building. I don't know if any of you are familiar with the old Granby Street that where the Neon is now, and where a place called the Plot is now. Back then, it was a place called Zeds, which was a dilapidated, I think, furniture store. And that block, outside of the gun shop and outside of Greyhound Station, was pretty much known for robbings and muggings and derelict activity. And a group of concerned individuals came together and brought some artists and got museum participation. And we pretty much volunteered our time to paint this building. And within weeks of painting that building, we saw which was a crime-ridden block, a crime-ridden neighborhood turned into a tourist destination. Within months, we saw small businesses popping up in those empty spaces surrounding that location. Within a year, it was a thriving community. Within 2 years, it was an arts district. Now, almost 15 years later, it is the center, the unofficial center of the arts in all of Hampton Roads. So how does this happen? How does the arts spark and beautify life? I was having a conversation with Larissa before we started here about passion, and how passion can oftentimes lead to community and lead to purpose. When we think about those 7 principles, that 7th principle being the need to create. Usually we think of artists as the creatives in our community, but all of us need to create to some extent. We all create meals, we all create stories for our kids, we all create all these things daily. But how can this play into our lives? Thinking about creation leading to purpose. So we do artist residencies. We focus on 2 primary artist residencies every year. One is the First Patron Initiative, which is sort of modeled after the WPA. It's an all-inclusive funded residency where artists get a chance to be in residence with us for a year. They get not only funding, stipends, studio space, connection to art world professionals, and lots of experience, but also they get a chance to go back into their communities and do some meaningful work. So I think about a project that we did, the Newport News Street Museum. We did a Norfolk Street Museum some years prior to, but the Newport News Street Museum, similar to Zed's, it was a way that, looking at what does our city need. So I've been meeting and talking with the city manager of Newport News for some time about beautifying certain neighborhoods, and last summer we finally took a bite at it we were commissioned to put up 10 murals in the course of 2 months around Newport News. We ended up putting up 14 murals, but one of which very near and dear to me. It was a location on the corner of 26th and Jefferson Avenue, which was a building that I used to pass as a kid almost every day, headed home from my grandmother's house. And when I was a kid, it was a Newport cigarette advertisement. From maybe the time I was like, I can remember 3 years old to maybe 12 years old, it was a big Newport cigarette advertisement. And it was a rotating advertisement. It was always a different Newport cigarette advertisement, but it was always Newport. And that image was burned into my mind as a kid. As an adult, I had the opportunity to paint an Ella Fitzgerald installation mural and have it stuck there. And then a few years ago, we painted a permanent mural. And thinking about all the people who passed that, because it's an entrance into the Highway 64, there's thousands and thousands of people who pass that site every day. I just think about the children who passed that, seeing Ella Fitzgerald on the wall, and knowing a lot of people didn't know prior to that Ella Fitzgerald was from 2 blocks away in that same neighborhood. And to be able to see yourself reflected in greatness and to see your community reflected, I think can do wonders. I have a lot of more interesting things to say, but I don't want to take too much time. So I will wind it down, and I'll leave you guys with just a quick thought on the arts and how arts can lead to your passion, and what it can, I'll stop here actually. I'll stop because I want to leave space and time for everybody else. But, when we think about the arts, I think this building is a wonderful example, and what a better place to do it. A place that reflects shelter, a place that reflects community, health, but also you see beautiful displays of art here for us to think about and reflect on at the same time. So I'll stop there, ping me after, and we can talk more, but thank you all so much.
Thank you so much, Asa. So wonderful to see these examples and hear these examples directly within our community of the arts impacting social determinants. Next up, we have Meredith Strand. So Meredith Strand is the Regional Director for Centera's Oncology Service Line. She has oversight for the Centera Brock Cancer Center, which is a $93.5 million, 253,000 square foot facility that opened in June of 2020. Meredith earned her Bachelor of Science degree in Kinesiology and Neurosciences from the College of William and Mary, and her master's degree in Health Administration from Virginia Commonwealth University. After a few years with ECU Health in Greenville, North Carolina, Meredith joined Centera in 2012. Like many of us here today, Meredith has a strong interest in improving whole person care. In 2022, Meredith had the opportunity to lead the development of the Carrillo Kern Center for Integrative Services at the Centera Brock Cancer Center. Since implementation, she has had the privilege to see the positive impact of integrative services on many patients' quality of life. Welcome, Meredith.
Thank you for that introduction, and thank you for the opportunity to join. Thank you for the opportunity to join you all today. Great presentation so far. I'm really looking forward to the discussion that we have after the presentations as well. I'm pleased to share a few highlights from the Carrillo Kern Center for Integrated Therapies. We're only a couple of years old, so our journey has just started, and so I'm looking forward to learning from this group as we continue the social prescribing journey. And I tend to be a quiet speaker, so raise your hand if I'm not well enough. I'm really going to try to project. So today I thought we'd talk a little bit about the origin of our center, the referral process, and some resources that have really helped us to get started that may be helpful to you as well. So first, when we were envisioning the Centera Brock Cancer Center, we had a number of focus groups in our community to learn what our survivors and our caregivers felt was missing. What were some of the real opportunities? We knew we needed to co-locate services because we heard from our survivors they were driving in many different places across Hampton Roads for oncology services. The other thing that we really heard was we needed whole person care. And so you see here some of the quotes that came from patients and our focus groups about the needs for additional complementary medicine in our community. And so this started the idea, and then we were fortunate to have two major donors fund the Carrillo Curran Center for Integrative Therapies. They had experienced as caregivers the role of integrative medicine in the lives of their loved ones during a difficult journey. And so we formed the Carrillo Curran Center to include acupuncture, garden therapy, integrative nutrition, massage therapy, mindfulness meditation, pet therapy, Reiki, Tai Chi, music therapy, Wellness Beyond Cancer, which is much like a Livestrong program. It's a total wellness program, both with a meditation as well as an exercise component, art therapy, equine therapy, peer mentoring, and restorative yoga. Some of these are individual one-on-one programs, and some are offered in a group setting. So we opened in April of 2022. We've seen significant growth since our doors opened. We just recently expanded to the 6-day per week and are open to the evenings. We also are moving outside of the walls of the Centera Brock Cancer Center and into the community and a number of other different locations. So we've definitely seen that the need is there in the community. These are a couple pictures of our center. We wanted this to be markedly different than the average healthcare setting. So we worked with our arts committee. We are very fortunate at the Brock Cancer Center to have an arts administrator and an arts committee. And so they helped us with some additional patient focus groups to think about what the right setting would be. We wanted something with spa-like qualities. So as soon as you walked into that center, it felt markedly different. We could start talking about that holistic setting. So we have a 3,000 square foot center on the 4th floor of the cancer center. This is across from our rehab center, and so it kind of gives us that wellness floor. It's a very comfortable, restful space, has a lot of natural light. We're fortunate to have plants in the space, and a number of different local artists have contributed pieces in that space as well. There are 6 treatment rooms. You can see on the wall there are also Himalayan salt walls. They can be backlit in a number of different colors. We also have the opportunity for natural scapes depending on the patient's interest. And we opened April 18th of 2022. We knew that we had to figure out how there was a need in the community for these services, but how we started to educate the community, so patients, caregivers, and our own providers about the role of integrative services. We had tried a number of different new programs over the years, and often one of our biggest challenges was, while we had a need, was connecting people to that need. And so new programs would go underutilized. And so we wanted to make sure that this generous donation would be very impactful to the patients that needed it most. And so one of the things that we looked at was, we know that our providers are very accustomed to entering orders into our electronic medical record. And so how could we make this just as part of our referral process, our existing referral process, and have a referral to integrative therapy? And so something as simple as building that out in our EMR was very helpful to kind of make it part of the routine care plan for our providers. For those providers who don't function in Epic, we also have a paper or fax form that can be selected. The provider may not know exactly what treatment best interests the patient. They can have that conversation on what that is. They can also check multiple boxes, and then the referral coordinator will work one-on-one with the patient about which services they'd like to start with. On the next slide, I'm going to talk a little bit about our nurse navigator protocol. That has been huge for us and something we learned from the Integrative Oncology Leadership Council. That's a national think tank on how you embed these types of programs. And we're also open for patient self-referrals. We have a lot of people who just want to try it, see what it's all about, and then working one-on-one with their practitioner, they develop a care plan that best meets their needs. So our oncology nurse navigators, this is their pathway. So generally, they come in contact with the patient around the time of diagnosis, and then they have a process, depending on that patient's acuity level, to connect with the patient at key stages throughout the process until they transition either to end of treatment around the 3-month post-treatment phase, or if someone elects hospice or to no longer continue treatment. So after the initiation of treatment, we felt like that was the best time to introduce our integrative therapies. When a patient is first getting a diagnosis, there are a lot of appointments, there's a lot going on, and so thinking about another commitment in the schedule, another change, didn't seem to be the right time for a lot of our participants. But once somebody has a treatment plan and is going to be coming into our walls already, the opportunity to participate in some of these integrated programs before or after an existing appointment, it means not driving the car one more place, right? They're already there, seem to be a great benefit. And so our navigators talk with each of the patients at the initiation of treatment and do a standardized assessment to identify what that patient's needs were. The standardized assessment was also really important to us because what we learned was that our navigators and our providers were having the conversation with patients based on their beliefs when they thought the patient would benefit from these services and not necessarily when the patient or family felt like the time was right. So we implemented the personal health inventory. This is from the Dr. Wayne Jonas Institute, and so they had developed a really nice hope note, really looking at holistic whole person needs. And so we adapted this and we're the first institution in the nation to do a study on implementing this into the electronic medical record. And so after the initiation of treatment, this gets sent to the patient in their MyChart, their patient app. The patient fills out a few quick questions, and then that's sent back to the navigator. And so this is a paper-based form of the PHI, but generally this is filled out electronically. Then when the navigator has their next touch point, regularly scheduled touch point with that patient, they talk about what the patient's needs are, that whole person care, and they make recommendations for the various integrative services that might support the patient best. We've talked a little bit about funding today. Funding is one of our current challenges as we continue to expand this program. We are very fortunate to have a generous donor who gives us the philanthropic dollars to start the program. We are working towards how do we measure this so we can advocate for some coverage through insurance companies. Things like acupuncture and nutrition are available for select diagnoses, but not currently well covered for oncology, despite the clear benefits. So we're continuing to work towards that. These are a few resources, one, our website, but also a few other websites that we found particularly helpful that I'd like to share with you if you're interested. And thank you all very much.
Thank you so much, Meredith. That was really helpful to see how a health system here locally in Hampton Roads is already starting to integrate this, particularly with looking at building on something that Larissa presented about as well, of integrating it and making it as seamless as you see within the electronic medical health records, the referral process, all of that, as well as addressing accessibility. So thank you so much for sharing that. Next, we have Kelly Burrows. Kelly Burrows has been serving the Jewish Family Services and Embrace Counseling as CEO since September 2018. She demonstrates extensive experience leading social service and behavioral health programs from clinical and administrative sides. Kelly previously served as the Vice President of Clinical Services for Jewish Family and Children's Services of Southern Arizona, where she worked with executive leadership, boards of directors, and community leaders to create sustainable programming to diverse populations throughout the Southwest. Her work helped shape local and state policies related to human services systems. Additionally, she helped build awareness among community leaders and policymakers on the need to support agencies and programs that serve at-risk populations, especially related to trauma. Welcome, Kelly.
Well, coming last, I don't know what else to say. Honestly, there's been so many great things that have been said about social prescribing, and so I was just going to share a couple of examples, and then at the end, we're going to save about a minute or two to do a little exercise together. Okay? So, as Dr. Ajmani said, my name is Kelly Burrows, and my background is as a therapist and certified in trauma. And, trauma is a whole lot of stuff, right? There's no definition, one definition of what trauma is, and those of you who work in hospitals probably see trauma maybe a little bit differently than somebody who works in maybe a residential treatment center versus somebody who might work in a group home or in a shelter for families. Trauma comes all over the place. And when we think about kids and families who are going through some medical issues, we really need to look at it from that holistic point of view, but also from a trauma lens. And so Asia said something about the building here and how beautiful it is, and I can't agree more. I mean, just the colors and the lightness, the CHKD's behavioral health, I'm not sure what it's called, the inpatient treatment program at CHKD for children, gorgeous. And the care that was put into those from a trauma lens was just so extraordinary. Everything from the colors and the way the building's laid out and the programs they have to the little things like the caulking around the windows that's non-pickable so the kids can pull it apart and eat it. And we were talking at the table here with Vivian, and they were talking about some other holistic things in a garden that CHPD is going to put in, and that perhaps at some point those vegetables or whatever they grow will be edible. The kids can make salads, or they're nurturing something was the words that were used. And so all of those ideas are so great, right? There's so much that we know, we already know, but it's how do we put it into a system that works? And that's the big challenge, it really is. And so I wrote a couple of things down here and got my glasses, so let's see if I'll remember what I wrote. I'm going to talk about a couple models real quick before we go to the next slide. So when I was in Arizona, I've had a really fortunate career in my life that I've gotten to meet with people from all kinds of walks of life, and from the people back in the 1960s who were doing like the Dickey experiment with kids with autism, but we didn't know that's what it was called then, and they're all sitting around, and there's these old films of them with these white men with their turtlenecks and their pipes, and they're all sitting around in these chairs talking about, how do you treat kids with these problems? And then, and then you fast forward to, in the 1900s, where they were, and into the late 1900s and the early 2000s. And I got to work with them, and their way of thinking really evolved over time, right? And so I was really fortunate to get to work with them, because really seeing it from this wraparound model where it's not just a person in their diagnosis, right? It's who are they? Who are they, and what do they need, and what does the family need? Because we can treat the kid all day long, but if they go home to a situation where the family's still struggling, that kid might be great for a minute, but he's got to go home. We've got to help shape the whole system, the whole family systems. But we do that. We can do that. But I just want to say we have to do it carefully, right? So all these things that we could put into place, what we don't want to do is unintentionally shame people for who they are. And I think that sometimes we get into that because we're the big caregivers and we're the professionals, and so we know what to do, right? And it becomes this cycle where then nobody wants to come back. So it's so cool to see so many new models that are coming out, and how just the environments are created to be family and kid friendly, to be trauma informed, and then also the approach we're taking with families and with kids, so that it's not about what's wrong with you, right? It can be what happened, what's going on, and tell me about you. And so there's a model that I worked with in Arizona. It was for adults, actually. And I'm trying to pick from things that people have already said, just to give some examples. And I think Larissa was talking about the burnout, really, of folks who work in this system. It's really difficult, right? We see it, we struggle, and we go home, we're supposed to pretend like, oh, I'm off work now. But we know that doesn't happen, right? But we also know that adults who are struggling with whatever kind of disease, whatever it is, they're struggling when they leave the center too, right? So there was a model at this program called Art Awakenings, where it was an art studio that was in funky town part of Tucson, which was kind of, they were trying to revitalize, right? And so they were creating an art district there. And it was this old building that was turned into an art studio for adults with significant or serious mental illness, so SMI. So people who were coming in there were people with bipolar disorder, people with addiction disorders, all kinds of folks coming in. But when they walked through that door, they weren't the alcoholic, they weren't the person with bipolar, they were an artist. And they were there to create things. And so we were helping people really shape new identities. And the really cool part about that was that as those folks are going through their journey of recovery, for whatever that looks like, they got, some of them who wanted to, they got trained to be peer mentors. And so not only did they start to see themselves, I'm an artist, but I'm also a friend, a counselor, a peer support specialist, and they started earning an income being able to do that. And so it helped them with some of the struggles that they had with their job sustainability and things, because it was difficult to be in an environment where they weren't identified by their diagnosis. So that's an example. Right now, the Jewish Family Service and Art Brace Counseling Program, we've been working with Edmark. Are you guys familiar with Edmark, the Children's Hospice Program? So for next month is our 25th anniversary of working together with them in our program called Piece by Piece. And that's a program where it's children who are grieving and their families can come, and there's support that's offered and different activities. But every year we do an art show, a grieving children's art show. And so in our offices, if you ever want to come visit, you're welcome to. We actually have 2 offices now. You'll see that artwork on the wall and it's framed. And recently this kiddo walked by and he was like almost offended, like, but where's my art? Because we hadn't had the show yet, but he saw it like past years. He really was identifying himself as coming there because he was creating an art piece, not because he needed therapy. Does that make sense? So we're really trying to help people to see themselves in a different way. Asa said something that I wrote down, to see yourself reflected in greatness. And I wrote that down because I felt like that was just such a great quote, because don't we all want to see ourselves in greatness? Don't we all want people to see something within us other than, our diagnoses? We do. Whatever that diagnosis is, whether it's a behavioral health or mental health or a physical health diagnosis, we're more than that. And so that's kind of what I think about when I think about social prescribing, because we look at things sometimes through this patient model of healing, right? So here's a person and they have all these doctors and they have nurses and they have all these specialists and these therapists and they have to go to occupational therapy and speech therapy and mental health and sometimes all these other types of therapies, and then they have, phlebotomists who are taking all their blood all the time. It's like, it's traumatic, right? And because when they come in, we see them as patients. We're coming in, you're a patient here, sign in, do this, sit down, we'll call your name, come over. And it's getting so much better, but it used to be that you would just have to sit there and wait. There was nothing for children and families to do while waiting, and it's scary enough for kids, right? So we saw them through this kind of medical model of healing, whereas social prescribing really sees that whole person. And I'm not saying anything that hasn't been said already, so I'm not going to belabor it too much, but in these models, we're looking at you as a whole person. Who are you? Who are you? Yes, you have this diagnosis, and that diagnosis is part of who you are, but you're also a really good friend, and your friend comes to your appointment with you. That's an intervention, right? You're also, you have a brother or you have a sister, they're a pain in the neck, right? Like, we all can relate to that, and you get to know them from, oh, your sister's your best friend. Does she want to come with you to your treatments? But you're also someone's kiddo, right? You're also, oh, you play the clarinet, that's cool. You're also a student, how are you doing in school? You're also an artist, oh my gosh, that's a great painting that you just did. Can we hang it up on the wall? You're an athlete, oh my gosh, you're on the soccer team, cool, what position do you play? Right, we're really getting to build what this person is other than just a patient. Okay, so I could tell you stories all day, but I think I just picked one. This is Jacob. This isn't really Jacob. This is a picture from, this is not a real person. There's no HIPAA going on. This person's name is not Jacob. This is a different person, right? But this kid that we worked with, he had sickle cell anemia and is on the autism spectrum disorder, is what his diagnoses were. I wasn't sure if he was really on the spectrum or if he was just having a trauma response to all the interventions that he had to have all the time, but that's a whole different discussion. His presenting problems really were around depression. Obviously, he was not feeling, the same as his peers, the things that were limiting for him to do. A lot of social anxiety, a lot of anxiety about going out and doing things. And part of that, his parents were very anxious for him to go out and do those things, for his susceptibility for infections and things. He had what they called poor adaptive skills. And again, was that really, when we say poor adaptive skills, I would rather change that to say he had adaptive skills to his environment, right? So how can we create an environment to help him adapt better rather than making him try to adapt to all the multiple different environments, right? Very sedentary lifestyle, obese and really not very active. And worst of all, he was very isolated. And, we talked earlier about loneliness and the epidemic of loneliness in this country and in this world, really, and after COVID, the toll that took on a lot of our kids and adults. But loneliness, you probably know this, there was a study that was done that said it's something like smoking a pack of cigarettes a day that has the same health detriments as smoking a pack of cigarettes a day. Loneliness is a huge epidemic, and it's really difficult when you're struggling with health conditions and you don't have anybody on your side, or you feel like you don't have anybody on your side that doesn't see you as something other than your diagnosis. So this fella, we got to working with him, and we just explored what are your interests, what are your talents, what are the things you like to do, and then we got that community involvement and intervention, and using the social prescriptive model. So, there's a lot of people who work in places in this community who would be willing to help. And we just have to identify who those helpers are. And so in this case, this kid, I really love music so much. Also love taking things apart a lot and trying to put them back together. And one of the interventions that the health worker did, the specialist that took them out, was they take them to the guitar store. So the guitar center type places where there's just so much stuff to explore. And they let you touch most of it, and you can play the drums and you can play on the guitars and things. Working with an identified person there, because when you go every day, they start to recognize you, and to go and say, hey, you know this kid, Jacob, right? Can we talk about maybe, can he have a job here? Now, is it a paid job? Maybe, maybe not. In this case, it wasn't. But his job was helping them to unpack all the guitars, taking them apart, right? And putting on the strings and putting in the face plates on the body of it. He got to be a member of staff. He was no longer the kid with sickle cell anemia who came in with his worker every day so that he could get out of the house. He had a purpose. He had a reason for getting out of the house every day. So this is an example, right? There's another kid we worked with, not surprisingly, loved video games. And this kid just could not relate to anybody except through a video game. And it was funny, I laughed because sometimes it's those aren't real characters, you know that, right? And so Halloween was great because then you could dress up however you wanted, but when it's April, that's kind of a little bit more odd. So what did we do for him? We went to the GameStop, and same thing with, at the guitar center, we helped him get a job at GameStop. So it's not weird to talk about video games all day long, right? So helping people to identify what resources are in the community and helping them get there is really what social prescribing is about. So we're going to do a quick experiment. I was going to bring my drums and I didn't because I thought it wouldn't work, but then we're going to do it anyway. There's a video I had and I couldn't find, but there's a video of this little girl that we worked with, and we were at the Phoenix Children's Museum with her. She was so dysregulated. That girl was all over the place. And we would bring her there because it was okay for her to be dysregulated there, because if she's running around, she's not any different than all the other kids. But there was this giant drum. And when she came in, she ran over and she would just kind of lay on the drum, and the drum mimicked her heartbeat, right? And so we would let her do that, and then at the end we would tell her to hug the drum goodbye, because we wanted to see her heartbeat change. And we saw that when she came in, her heartbeat was just all dysregulated, and she was all over the place. By the time she came out, her heartbeat was regulated. So let's all do this, can we? Let's just all tap the table, just however you want to. See how you all regulated yourselves to each other? Do you all notice this? That's a little bit what it means to be paired up with somebody, right? And to really start to mirror them and what they're doing. I wish I had the video of the little girl, but I thank you guys. I'm excited to sit in the breakout sessions with you, and I want to thank Wendy for bringing this to Hampton Roads, and Dr. Ajmani. Thank you.
Thank you so much, Kelly. I love how each presentation really builds on each other, and I hope that everyone got a lot from each of the presentations. I know I did. Thank you so much, Kelly, for sharing these examples, as well as really pointing out with this model, we really are helping people almost expand their identities, right? Expand how they feel that other people view them and how they view themselves, and the power of that in their healing journeys. I think is just incredible. And also asking that question, what matters to you? I'm reading a book, I'm almost done with it, and actually this book is being gifted to each and every one of you, called The Connection Cure, that just came out this summer, which is about social prescribing. And in that, the author writes, social prescribing is really shifting from what's the matter with you to what matters to you. With that, let's take about a 5-minute break, and then we'll come back together and we'll do our breakout session.